If you wouldn't mind, what is quantitative imaging? Can you give a little bit of an overview of what that means exactly?
You can get a lot of information out of a CAT scan. So when it comes to CT lung screening, which is looking to try to find early stage lung cancer in patients who are at high risk for lung cancer, we image the entire thorax or the entire chest. And inside the chest, you have the lungs, but you also have the heart, you have the thyroid, you have bones. And we want to try to figure out this, with all that information that you can quantify findings, pathologic and normal findings in the chest. We want to figure out ways to use that information to optimize health.
In clinical medicine, cancer used to be detected quite late, and it was large, about the size of a peach. Whereas now, with the improved resolution, we can see things at the level of the size of a pea.
And that's kind of why everyone's here. It's a quantitative imaging workshop, and that kind of goes hand in hand with cancer prevention and early detection imaging. And from what I understand, Prevent Cancer Foundation and lung cancer screening kind of also go hand in hand in a lot of ways.
You interviewed Dr. Jim Mulshine. He called me one hot night in August and he said, "Bo, you're not going to believe this. There are these two scientists in New York, radiologists in New York, and they have just published a paper. You've got to read it. It shows that using CT scanning can detect early lesions in the lung that are stage 1 lung cancer, which cannot be done on a chest x-ray." And he said, "We have got to meet these people."
We worked very hard on getting this paper and getting all the data together and really trying to show that lung cancer screening works. It took a lot of effort and so on, and 2 randomized trials to show that we were right, that you can find it early, and if you find it early, you can be cured most of the time, over 80% and maybe as high as 95% if it's early stage.
And emerging research, sparking that is kind of one of the big benefits of putting a bunch of brilliant minds together at a workshop like the QIW.
Absolutely, it's a crucible.
Workshop. Yeah.
And it's the only one that really focuses on this. So it's the 19th workshop?
19th workshop.
Yeah. So that's really impressive.
This workshop is a perfect example, and what workshops like this do is bring experts in multiple different aspects of the field who are all pretty passionate about early detection. It is kind of like a think tank, when we all get together, not even just at the meetings or the breakout sessions, but wherever it might be, we share ideas about what we're each individually doing, and that just creates, this effect where we're building upon each other and able to inspire one another.
It's brought together people that are committed. You have to sort of step back for a moment and just say, this is the #1 cancer killer. It is by far the biggest target that we need if we want to make an impact on cancer in the world. And this workshop brings together all the different components, from the imaging people that read the scans, from the people that develop software, to the people that develop public policy, to the people that do reimbursements, all of them that have a real passion come together at this forum. I think there's just nothing like this in terms of, what it's capable of doing.
Lung cancer is still the leading cancer killer of Americans and globally. And if we can do anything to help reduce the terrible toll that lung cancer takes, then we should be all in.